we'll just do an introduction to start
Yeah,
with.
sure.
Yeah, so can you introduce yourself and explain what you do in the general context of your practice with people and your research and your writing as well?
Okay, well, how long do you want me to talk for? My name is Jon Kabat-Zinn, and I'm a professor of medicine emeritus at the University of Massachusetts Medical School. And the work that I do revolves around a clinic that I started 34 years ago now called the Mindfulness-Based Stress Reduction Clinic, or MBSR. And the idea of this clinic back in 1979 when it started was an experiment to see whether we could actually catch people falling through the cracks of the healthcare system and introduce them to fairly intensive Buddhist meditative practices without the Buddhism, and see if that couldn't add a whole other dimension to their trajectory towards greater levels of health and well-being, starting where they were, which is with, for the most part, fairly extensive chronic diseases, which they had on average for about 7 or 8 years. Lots of chronic pain patients, people with heart disease, with various kinds of cancer, with headaches, you name it, we would take it, because when you put out stress as the overall umbrella in which things come to you, well, everything is stressful, you know, to different people. So any kind of chronic medical condition either is caused by stress or compounds the stress in your life. So it was a very, very big umbrella and an invitation for people to see what they could do for themselves that no one else on the planet can really do for you, utilizing these meditative practices that really have to do with paying attention when you boil it right down. So there's nothing particularly magical or mystical about it, but to cultivate this muscle that we have intentionally, to pay attention on purpose in the present moment and non-judgmentally, which is my working definition of mindfulness, and see what would happen. And that's exactly what we did. And even in 1979, when our healthcare system was very, very different from the way it is now, people were falling through the cracks. I would say that nowadays it's no longer cracks, it's like chasms. People are falling through the chasms of the healthcare system. And Ralph Snyderman, who was chancellor at Duke University Medical Center for 10 years, wrote a paper with Andy Weil, the first sentence, I think, of which was, "The chassis is broken and the wheels are falling off," to describe how ineffective medical care, especially for chronic medical conditions, could be. So the idea of getting the patient to participate fully in his or her own movement towards greater levels of health and well-being by cultivating these deep, you could call them, interior resources. And let's say, what would those be, those deep interior resources that attention might actually cultivate? Well, they would be learning, which means changing the patterns by which you understand things. And that has everything to do with apprehension through our senses and through how the senses get organized in the brain and combined with cognition and emotion. So learning, and then out of the learning, growing. Out of the growing, a certain kind of coming to terms with things that may be very difficult to come to terms with, and that is my working definition of healing. And then transformation. And transformation in the sense of, usually we have a very diminished notion of who we actually are. And we have a narrative, a story of who I am and how I'm good at this and no good at that. And very often they're more on the negative side than on the positive side. And one of the hopes was that people would actually cultivate, through direct realization of who they are, a much bigger understanding and a much bigger, you could say, narrative, or just give up the narrative entirely and live life as if it really mattered and not worry about your PR. And so this is now 34 years later. It turned out to be a model that was very appropriate, and it was almost felt like we were giving food to starving people, to offer them this kind of a stress reduction clinic where they could participate in this way and cultivate these deep muscles of attention, awareness, kindness towards oneself, and self-compassion. And of course, it was also very stress-reducing for the doctors, because when you're not actually able to help people with chronic medical problems, you don't feel that good either. So if you have some place that you can send people to roll up their sleeves and do a certain kind of work for themselves that you can't do for them, that is very satisfying from the point of view of the doctor. And then the patient will come back and say things like, and this happened early on in the stress reduction clinic, I remember it very clearly, "Thank you for sending me to the stress reduction clinic. That was the best thing you ever did for me." And of course, it's not a critique of the doctor, a criticism of the doctor, but it's saying, you put me in touch with myself. And that's easy to say in words, but it has a certain, once you're practicing these meditative approaches, it's like dropping into an aspect of being that's been here all along but completely hidden. But imagine if you made that like your default mode and you actually cultivated that way of being embodied in the world without having to make things happen in a kind of appearance sort of way, but where the essence was, in some sense, nurturing you. I think that has an enormous potential for actually giving rise to balance within the organism on virtually every level, from the brain to our chromosomes to epigenetic factors and telomerase factors and all of those kinds of things, so that the more you are like integrated in yourself, the healthier you are.
You've just answered my first 5 questions, which is wonderful.